The initial thought when the pandemic first began was that, like many viruses, COVID-19 would thrive in cold weather and struggle when the summer months began. But that didn't happen. A second surge of the virus arrived in July, and one of the people impacted by it was Governor Kevin Stitt. Rory Taylor looks back at July, August, and September.
At the beginning of July, we were running about 370 new cases per day and sitting just under 400 deaths. This, it seems, was enough to prompt our governor to wear a mask in public for the first time.
But yeah, it's not that hard. Not that hard to wear a mask if you can't be social distance.
That same week, Oklahoma held its primary elections, selecting candidates for federal and state legislation. The ballot also featured State Question 802, Medicaid expansion, which passed by less than 1%.
200,000 Oklahomans are going to get access to health care that they don't have now. We're going to be able to bring back $1 billion of our taxpayer money and invest in our communities. That means more jobs and more local, state, and local revenue, tax revenue.
How the state's share of that expansion will be funded is still in the air, but will be decided in the upcoming spring's legislative session. The week of July 6th saw Oklahoman cities holding council meetings to discuss that ever-heated issue, mask mandates. On Tuesday, July 7th, Norman became the first Oklahoman city to pass a mask ordinance.
What it really boils down to for me is that the vulnerable and immunocompromised in our city have just as much of a right to move safely through this city as anyone else.
Norman was the first, but many other cities, especially Oklahoma's more populous, followed closely behind, and currently, mask mandates cover a portion of the state representing roughly 40% of Oklahoma's population. But those local mask mandates didn't keep COVID from reaching Governor Kevin Stitt, who tested positive Tuesday, July 14th.
I'll be taking precautions. I'm now isolating away from my family. I'll be working from home until it's safe for me to get back to normal. So I'll be doing a lot more Zoom calls. Commissioner Fry and I have worked with contact tracers based on when my symptoms developed.
Around that same time, the tax and criminal justice systems in Oklahoma were shaken by the landmark McGirt v. Oklahoma ruling by the Supreme Court, which dictated most of eastern Oklahoma to still be tribal territory.
What the court decided was that as a result of those boundaries reflecting an Indian reservation today, the state lacks jurisdiction to prosecute crimes by or against tribal members in that area.
Oklahoma's 5 tribes view the ruling as a massive victory for tribal sovereignty.
Expanding the tribe's criminal justice system.
We are expanding our law enforcement as well as our district and attorney general's department. So we're doing everything we need to do. We're just growing.
It's also left many court cases that would before have been under state jurisdiction in the hands of U.S. attorneys.
In about the first 3 to 4 weeks since the decision, we've been referred over 114 cases that typically would have gone to the state district attorney's office. So it has been literally a flood of cases coming our direction.
Nearby, and shortly later, Tulsa was preparing to begin a historic search for the mass grave of victims of the Tulsa Race Massacre.
I am honored and humbled to be here in this day and time to witness this time in history, to stand in their stead as we try to go about remembering them, bring about the truth, and sharing that truth with our community to bring some sense of closure to that horrible time in our history.
Those efforts came to fruition when 12 coffins were found in late October. July ended, of course, with a new COVID flare-up. The last week of July, the Oklahoma Department of Veterans Affairs announced an outbreak at the Claremore Veterans Center.
At the present time, 7 residents who have mild to moderate symptoms are being cared for in-house at the Claremore Veterans Center. The 3rd floor has been temporarily converted to serve essentially as our COVID positive ward within the center. 7 residents are being cared for in local Claremore area hospitals. 13 residents are being cared for at the Muskogee VA Hospital, and 23 residents are being cared for at the Oklahoma City VA Hospital.
Within the month of July, a 5th of the center's residents tested positive. Of that 5th, another 5th died. While other VA centers weren't as hard hit early on, nursing homes across the state were constantly on alert. As the summer wore on, the federal government distributed rapid result COVID tests to nursing homes to help mitigate that. But as August settled in and the governor came out of quarantine, those numbers still trended in the wrong direction.
Monday's report says that we have about 375 active cases in nursing homes, and that's residents and staff. But there's a lot of concern that as nursing homes start to reopen to visitation and as some of our hotspots around the state continue to move, that community spread is going to infect staff, visitors, hospice workers, and others who might be coming in.
Unfortunately, the fall and winter only saw cases and deaths accelerate in the long-term care facilities. On August 13th, now-recovered Governor Stitt announced some good news. Oklahoma is a top 10 state for bridges.
Just to put this in perspective, in 2004, there were 1,168 structurally deficient highway bridges. Now, there are currently 86 structurally deficient bridges with plans to address each and every one of them.
Into late summer, COVID numbers, of course, continued to drift upward. Stillwater saw an outbreak as students returned to college. But the biggest COVID hotspots were in the state's prison system.
A positive case makes me sick, but an inmate death even makes me sicker. And so one of the things that I've really worked to do is try to place an emphasis on everything that we could possibly do in working with the CDC or the state health department to mitigate this risk.
If it takes shutting the prison down to get it thoroughly clean, if it takes shutting it down, get them to another place, whatever it takes, take care of the problem.
Responses to the outbreaks included new distancing measures and mandatory testing for DOC staff. In the 3-month span from July to September's end, our rate of infection had tripled and our total deaths had more than doubled. September also saw 2 interim studies by the legislature focusing on discrimination and solutions.
The issue of race and what it's doing to us. How can we look at Oklahoma and get ahead of the game? How can we have some folk who are sitting down talking about those things that have brought us to this brink?
And it seems justice is dependent on data.
We are able to analyze every single court record. For the state of Oklahoma, we are able to disaggregate it by race. And we have found that there is no better geographic proxy for race than criminal court debt.
Rory Taylor, The Oklahoma News Report.